Hey guys, Godfather of Anxiety here. Just wanted to do a short video about my struggles with obsessive compulsive disorder. This has never been my primary diagnosis, but there's no question that I have struggled with it over the years. I've already done videos on intrusive thoughts and some of my experiences with that. So I figured I'd do a video that was a little bit more in depth as far as what personally I have experienced, and maybe it'll give you guys some insight as to what you can look for that might be maybe a precursor to having full-blown obsessive compulsive disorder, because I definitely think growing up I had some odd behaviors that probably would have fallen into a diagnosis of obsessive compulsive disorder. And I just, at the time, it's in the 80s. OCD wasn't even really known at that point, at least, not widely known. And so anyways, I figure this video will definitely help those of you maybe who have some of these same symptoms and have never gotten a diagnosis. Anyways, the signs that I had when I was young, there were certain activities that I could not stop doing. I remember specifically one time, it was time, we ate dinner as a family. It was time to go in. I knew that it was dinner time. I was hungry. I wanted to go in and eat. If I remember it correctly, I even think it was something I enjoyed, a meal I looked forward to. But I was on a bicycle and I was doing wheelies, and I could not go in until I did a wheelie the right way. Now, what was the right way? I don't know, but until it felt a certain way, I couldn't. And I remember my mother was getting impatient with me, and I was like, I want to go in, but I just was kind of held hostage to having to do it a certain way. And that memory never left me, because it was weird that this feeling inside, or this thought inside, was overriding my logical mind that wanted to go in and eat dinner with my family. I also noticed this when it came to athletic endeavors, whether it was throwing a ball, whether it was shooting a basketball. I could not stop doing it until I did till it felt a certain way. Or, for instance, I could never leave a basketball court on a miss. I just couldn't. I know that some of that sounds like, well, that's not really OCD, you're a perfectionist. Trust me, guys, I'm not a perfectionist. Ask my wife if I'm a perfectionist. But it definitely, I had things like that go on. And I really believe part of the reason why I got as good as I did at some of the athletic things that whether it was, sports or lifting weights or whatever, was because of this personality trait, or what I believe to be basically obsessive compulsive disorder, that made it so I had to do it a certain way. And if I wasn't able to do it that way, then I just had to repeat the activity over and over and over and over. And, hours and hours of my life were spent doing these things. And don't get me wrong, I love athletics, and, that was definitely part of the equation. But as far as not being able to stop until, that's just, to me, that's very suspiciously, OCD. And I honestly think also, if you look at athletes in certain sports, especially baseball, hockey, I think there's a lot of athletes in those sports with obsessive compulsive disorder. Like with baseball, you'll see the superstition, right? You'll see I'm telling you guys, in those sports, you get good at them through unbelievable repetition. If you don't start some of those sports when you're you know, by the time you're 5, you'll never be good enough at them to play at the highest level. So I think that's part of the reason why there's so many superstitious baseball players, because I really believe a lot of them have obsessive compulsive disorder. So those were some things that I noticed when I was young. Another facet of my personality that, again, does not really fit with me, that I've always had an issue with. Okay, so all of us, when we start to get an interest in a hobby, we might go gung-ho, right? Oh, I love this new hobby, whether it's hiking, singing karaoke, whatever it might be. You might really go crazy with it at first. Just a couple of hobbies that came to mind. But for me, it would become an obsession. And I would make dumb decisions. Like, okay, for instance, I love animals. For a while, I was very interested in parrots. We still have a parrot, and if you've heard anything during this video, that's him up there talking away. He's an African gray parrot. But just had to read every book. Drove distances I shouldn't drive. Spent money that I shouldn't spend. And they're not really like decisions that you would make normally. I would get like this when it came to cars or motorcycles, or just I would become obsessed. And again, whether or not you would define that as obsessive compulsive disorder, I definitely think, I very much showed signs of having, obsessive behavior. So that was another thing that I noticed before I actually had, obsessive compulsive disorder that was diagnosable. Shortly before I started having panic attacks, obsessive thoughts started to become more prominent. Now, I didn't have intrusive thoughts yet. Oh, you might actually call them intrusive, but they weren't violent or sexual or, had to do with germs. At that point, there was nothing like that. But something would get stuck. A thought would get stuck in my head, and it would keep me from going to sleep. I mean, literally. I remember I spent 2 days obsessing about something that I wasn't going to have to, if I was going to have to deal with it, it was going to be 3 years down the road. And I couldn't even get to sleep because it was just playing. You know how I could compare it? You know how you get a song stuck in your head? Well, picture that, but times 1,000 or so. And, it was something that I literally couldn't do anything about right then, no matter what. But I was just over and over playing in my head. I couldn't get to sleep. It was like 2 days I didn't sleep. I barely slept because I was obsessed with a decision, again, that I wouldn't have to make for years if I had to make it at all. So then, now we're to the point where I started having the panic attacks. About 3 months after that, I started having intrusive thoughts, really bad. Like constant, horrible, terrifying, intrusive thoughts. And clearly, nobody who's had intrusive thought, obsessive compulsive disorder is going to get on YouTube and tell you exactly the nature of their thoughts, because, they are so dark, they are so twisted, it is horrific. And the fact that you're not conjuring them up consciously, that it's just playing on a loop, this is, like I say, it's up there with derealization, depersonalization, panic attacks, and intrusive thoughts are all horrible in their own way. And they all have horrible effects not just when they're happening, but then even years later, they can still affect you. So, you know, I was having thoughts about, you know, all of the things that you read about intrusive thoughts. Violence, check. Sex, check. Germs, check. All of them. Constantly. And, you know, a couple that I can mention, I was constantly worried I was going to swerve into oncoming traffic. Of course, that became much more pronounced when my family was with me. Again, because it's that keeping you in the fight or flight, and obviously the stakes get raised dramatically when your family's with you. So that's when I remember just holding two hands on the wheel tight, just, you know, so worried that I was going to swerve into traffic. Also, I would, I had this thing where I would check every time I backed out of the driveway. At the time I was working at about 3 in the morning, 4 in the morning. I had to be at work. And I would back out of the driveway, and I would be convinced that I had run someone over. And I would actually get as far as a block away and have to come back around to make sure someone wasn't laying there. And I think my daughter was about 7 at the time, and I kept thinking it was her. I don't know why my 7-year-old daughter would get up in the middle of the night and stand in back of the vehicle. Again, these thoughts aren't logical, but I would have to sometimes I would go around 2 or 3 times to make sure that I hadn't backed anyone over. You know, I had behaviors like that started along with the intrusive thoughts. You know, they were omnipresent too. That's one thing I want to let you guys know. It's not like they went away when I went to work. In fact, depending on who I was working with or around, they would get worse. If it was somebody who I had a tremendous amount of respect for, whether at my job, you know, at my place of worship, at wherever it might be, I'd be worried I was going to either curse or say something inappropriate or do something inappropriate. It was awful. And what that ended up leading to was the one time when it would be a little less, it would still play. By the way, TV would trigger the heck out of it. The internet would trigger it. But if I was just by myself, it would be a little bit less. So for about a year, this is what I did. I mean, I isolated myself a lot, and it was awful, because you don't want to be around people when you're having these awful thoughts. You're worried you're going to say something inappropriate, do something inappropriate. Heck, the first 3 or 4 months, I mean, I thought I had lost my mind. I was thinking of, you know, maybe checking myself into an institution. But that brings me to how I was able to get through this. And really, one of the biggest blessings I had was I had a close relative who suffered from intrusive thought OCD. And it was somebody that I could actually talk to about what was going on without feeling like I was scaring them, because intrusive thoughts are you know, horrific, and they would terrify people. People would, you know, question what's going on with you if you told them what's going through your mind. But what he would do is he would listen to me, and he would explain that he had similar things happen, and that was huge. And then I have an unbelievably loving and patient wife, and an unbelievably loving and patient mother. And both of them were instrumental in helping me not completely lose faith in myself as a human being. You know, I remember probably, I would say conservatively, 500 times, I asked my mother and my wife if I was a good person. Because when you're having intrusive thoughts like that, you question everything. You question your identity. Was I, have I secretly been harboring these awful thoughts and they've just been buried and now they're all coming out? And, so many things go through your head. But, I was so blessed and so fortunate to have people in my life who loved me, who were patient with me. And so then, you want to know, and I always want to do this in my channel. I don't just want to tell you guys the bad, the struggles, without showing you how I was able to get through it, overcome it. And that was basically, again, with the help of those loved ones, along with treatment, right? Fortunately for me, the intrusive thoughts kind of went away once I started to do some of the stuff that, the person close to me had explained to me might help. And basically, it wasn't until I got on the medications that, at least the one that I still take, that I really got solid control over all of my anxiety issues, including obsessive compulsive disorder. So what I would do is, and this is what you got to do. If you have OCD, and especially if it's intrusive thoughts, you're going to have to do therapy, okay? It's not about sitting there and talking with, spilling out your guts or talking about those thoughts. Those thoughts are meaningless. They have nothing to do with your identity. They have nothing to do with anything that you should even be worried about. But you are going to have to do exposure therapy to prove to your logical mind that you have no desire to do these things and you'd never do these things. So, a lot of this therapy you can do by yourself. Some of it you might want to do with a mental health professional, but you'll have to do exposure therapy. And then before I even get to that, so you want to seek treatment. You're going to be doing cognitive behavioral therapy, exposure therapy, but you're also, with OCD, you're going to have to label your thoughts as OCD, label them as OCD, and let them play. And this is so counterintuitive because if you're anything like me, when you have bad thoughts, like I think this is all of us, we're human beings, right? No, can you imagine if we were, held accountable for our thoughts? I mean, that wouldn't go over well. So, the inclination tends to be, well, I have a bad thought, I want to just get it out of my head. Try to use, just kind of force it out of there. You cannot do that with OCD. If you do that with OCD, it will intensify it. The loop will play faster. The thoughts will be even darker and more disturbing. And that was my first inclination when I started having these, and it sure enough, it made it worse. So label it as OCD and let it play. And you'll be surprised if you can just do that. I know that sounds, I know it's not easy. It's going to be really hard. But if you just say, no, that's OCD, that's not me, and you let it happen, it won't be long and it'll start to lessen. It'll start to dissipate. I'm not trying to say that it's going to go away. I'm not. Sometimes medication helps with that, but the less attention you give it, the less thoughts you'll have, the less intrusive thoughts you'll have, and the less they will affect you, the ones that you do have. Because you'll just say it's OCD. Now, guys, I still have to do that to this day. Just this last week, I have had intrusive thoughts. But as soon as I get them, I say, no, it's OCD. And I'm able to move on and not perseverate on them. So label them as OCD. Let them play. Get your sleep. I always talk about sleep, diet, and exercise. And it's no exception. With OCD, sleep is super important. And you go ahead and you see this. Somebody who has OCD, they start becoming sleep deprived, their OCD will go off the charts. It really will. So that's another thing that's important. Just with OCD, it's something that it's the solution to it's counterintuitive. So stay busy, get your sleep, label it as OCD, but don't fight it. It's all of these anxiety things, they're triggered by the fight or flight response. But if you try to fight them, you're fighting an imaginary enemy. And OCD falls into this. So if you try to fight intrusive thoughts, they'll intensify and get worse. You try to fight a panic attack, which, boy, did I try to fight panic attacks. It will make them 1,000 times worse. So a lot of this, even racing thoughts, will become worse if we focus on them. So a lot of getting better from any of the anxiety spectrum disorders, including OCD, is letting these thoughts play, letting these things occur, and not reacting / overreacting or overreact to them. Because, again, there's no logic here. You can't fight an invisible enemy, an enemy that's not there. There is no enemy. There is no imminent danger. And your body is reacting like there was. And your mind is doing the same. So that's how you're going to get better from this. And again, work with a mental health professional. I always tell you guys, if it's affecting your life, if it's making it so maybe you're missing work, or it's starting to affect your marriage or your relationship with your children, which that's one of the big things that started to happen with me, is I started, at the time, my daughter, when I first started having intrusive thoughts, my daughter, I believe, was 6 years old. And it definitely affected my relationship with my daughter for that year that I was really having intense intrusive thoughts. So if it's at that point, go get treatment. Go get treatment. You're not going to have to, no good mental health professional is going to have you sitting there talking about your intrusive thoughts. It does no good to talk about them. So that's not what's going to happen. As soon as you mention that you're having intrusive thoughts, they'll know exactly what's going on. If they're worth anything as a psychiatrist or a therapist, they're going to know what's going on. And they're going to know that there's no sense in sitting there talking about it, because it's not the result of some childhood trauma. It's not the result of some experience you've had. If you want to see any relationship with yourself in the intrusive thoughts, from my experience, it's the things that you find the most disgusting and reprehensible that your mind is going to use to keep you in fight or flight, and with these intrusive thoughts. So I guess so. If you're anything you're having intrusive thoughts about is probably the antithesis of who you are as a human being. So rest assured, this has nothing to do with your identity or any, secret, deep evil inside you. That's nonsense. But anyways, so that's been my experience with OCD over the years. And again, by labeling it, by working with a therapist, by having a loving family around me, I was able to get through that. And fortunately, out of all of the anxiety issues I've had, that has had the shortest duration of an intense effect on me, because it was only about a year that I had really severe intrusive thought OCD, and one of the worst years of my life for sure. But so that's what I wanted to say in this video. I wanted to share with you guys some of the things that I noticed in having the condition. Thank you guys so much for all of your engagement with the channel. I'm so grateful. And most of all, what I'm grateful for is the comments from you guys where you're letting me know that these videos are helping you, because that's the entire reason I started this. I figured, especially men, but just people in general aren't comfortable talking about mental health. They're not comfortable talking about these things. So if they see somebody who's willing to go out there and share their experience, maybe that will help them to realize what's going on with them, help them work up the courage to go and get help, or at least tell a friend or a family member what's going on, so that, again, I don't want people wasting the time that I wasted 6 years. 6 years in my 30s that are gone. Can never get them back. But, if you get anything from these videos, it will have been worth doing the channel, because that was really the impetus and the reason why I decided to do this in the first place. So thank you guys so much. And until my next video, take care.